Hey everyone, it's Joe Kral with the Society of St. Sebastian, and again, welcome to Pro-Life University. This week, we're going to kind of continue conversation that we had a few weeks ago on telemed abortions. We're going to actually kind of refocus a little bit, and we're going to be talking a little bit more about regulations dealing with the abortion pill RU486. And in particular, we're going to talk about the FDA restrictions that have been recently challenged and have been recently blocked, unfortunately, by the abortion industry. And we're going to talk a little bit more about that. And in particular today, I want to kind of focus on some of the ethical issues that are surrounding the issues of the duty of physicians and their responsibility that they have towards patients. In my telemed video, I primarily focused on how the abortion industry wants to show that abortion is so safe, and by, deregulating, if you will, these sorts of restrictions on the abortion pill, they try to kind of throw up this illusion, if you will, that abortion and the abortion pill in particular is very, very safe. And while that's true, I kind of want to focus more on the ethical side here as well, and kind of get into the problems that the abortion industry has with respect to their duties to their patient, because there are some severe issues that are at stake here when we talk about RU486 and what they're trying to do with respect to these restrictions. So let's talk a little bit about these restrictions first. Right. One of the things to fundamentally know is that these restrictions have basically been in place now for almost going on close to 20 years. And so the idea is that the drug is very dangerous. It's not just a simple, you go in one day and you take it and then it just happens immediately and then you're done. It's not like taking a vitamin or an Advil or Tylenol or anything like that, or even an antibiotic. It's a very dangerous, hard, and painful process. I think in many respects, and I mentioned this in my last video as well, but just to bring it up again to kind of emphasize the point. In the movie Unplanned, that's about Abby Johnson. Abby Johnson took the abortion pill, and in the movie they portray this particular scene, and in it we see how painful the process is. It's a bloody process, it's a painful process, and again, it's important to stay in contact with a physician. And in many ways, Abby points out how she felt she was kind of hoodwinked, if you will, with respect to the pill, to the abortion pill, and that they haven't given her enough information. So imagine if, a woman is merely just given a prescription over, FaceTime on over the internet, or just, given a mail-away prescription, so to speak. So it's important that these sorts of restrictions stay in place, right? Now, this really gets into some of the ethical considerations that we're dealing with here. Now, normally speaking, when we talk about, the patient physician sort of connection here and the duties that the physician has towards the patient, once that sort of relationship is established, all right, the physician certainly has moral duties towards the patient. He's got to see through the treatment, so to speak. All right, he's got to make sure that if the patient does suffer from harmful side effects, that he tries to fix those particular problems, or that he helps the patient to get off the medication if need be, or that the patient is admitted into the hospital to take care of those particular side effects and so forth. All right. And so this is an important sort of thing, to stay in contact with the doctor. Right. And one of the things that we note with RU486 is that it is harmful. Hemorrhaging does take place. Massive bleeding does take place, and hemorrhaging can occur to where a woman may need to be hospitalized, right? And we know that in certain instances, a woman might bleed so much that she may even die. So again, it's important to note that a physician needs to be on the ready to go, to be ready to facilitate his moral duties. Now, here's a big particular question. Now, why does the abortion industry want to kind of block this sort of moral duty of its physicians? And it's something, certainly, as me as an ethicist, I certainly wonder. And certainly something that I've pondered. And kind of the conclusion that I've come up with as a professional ethicist is simply this. I honestly simply think that when it comes to this particular issue, that what we're seeing here is that many in the abortion industry, abortionists included, and those who advocate for abortion and so forth, market for it, lobby for it, and so forth, practice vice. They're not practicing virtue. And to go back, when I talk about the classical virtues, prudence, justice, fortitude, temperance, all right? In many ways, those that are in the abortion industry are not practicing these sorts of virtue. They're kind of practicing the opposites, the vices of those. They're practicing intemperance, all right? They're practicing injustice. They're practicing imprudence, all right? They're practicing, cowardice instead of fortitude and so forth. So you can see in many respects, since they're not practicing these particular sorts of virtues, they're practicing vice. And as a result of this, they just simply don't want to perform their sort of moral duties. And that's why in many respects, we see this sort of attitude come out with them when it comes to asking them to perform their moral duties. And we can sort of compare this, especially with another piece of legislation. So, the Born Alive Infant Survivors Act, all right, which is a piece of legislation where, those infants that are born because they've survived an abortion attempt, we basically say that they must be given the medical care that's appropriate for that gestational age. We see the abortion industry opposing such legislation. Well, why? Most people with reasonable common sense would tell you, well, yeah, you should take care of this baby. Well, why? Because these people don't want to do their moral responsibility. And it's large in part, in my opinion, because they don't practice virtue in this area to begin with. And as a result, if they don't practice virtue in this area, they're not going to want to be required to practice virtue in this area. So it's a problem. And so, again, we can see it here in this particular area as well. They don't want to do their sort of the normal moral requirement that would be required of a normal doctor. They don't want to have to do this sort of thing with respect to their patients. Now, we got to remember, the normal doctor doesn't go about their business every day killing, right? Most doctors go about their normal day trying to actually help patients to get healthy, right? Abortionists go about their day killing unborn children. That's a problem. People who work within the industry, that's their business every day, is to ensure that these unborn children die as a result of abortion. So this is not an industry where you see a lot of virtue take place. And so as a result, I think in many respects, because of this lack of virtue and because of this stranglehold of vice, if you will, they just simply do not want to do what we would certainly consider just a normal moral duty. They don't want to do those normal moral duties. And so as a result, they want to take the easy way out. And they want to kind of put this garnish, this illusion, if you will, of, well, it's safety. This is purely safe, like getting a tooth pulled. Or in this particular case, it's just as safe as taking an Advil, right? When in reality, it's not. They just simply don't want to do their duty, right? So this is important. This is why we need to have these particular restrictions in place, these pro-life restrictions that were put in place. And again, we certainly want to thank the Trump administration for appealing this to the U.S. Supreme Court to try to get the restriction back into enforcement, because that is needed. That's there to save these women's lives as well. It's important. It's there to enforce a moral duty that needs to be there in the first place. Well, guys, I hope you liked this video this week. I appreciate it as always. And if you have any questions, down below in the comments section, give us a big thumbs up as always. And we'll see you next week. I hope you have a wonderful weekend, and God bless.